Hello, this is Tambar from Chicago Arthritis. An article came out today and I need to talk about this. So an article came out recently about TV Superman from the 1990s, Dean Cain, receiving a quote-unquote stem cell treatment for his knee arthritis. There's a lot of things wrong with this article. And some of these things have to be discussed because as patients and as physicians, we need to recognize when bogus is bogus. All right, you need to call that out. So number one, when you look at this article, there's a video attached with it as well, and you see a few things that are really quite wrong. To begin with, there's not a physician treating Mr. Superman. All right, that's a problem. All right, this is the nature of this part of medicine is that it's not only new, but it's highly specialized. You need to know what you're doing properly. You need to be well qualified. You need to be focused on doing this. If you're dabbling in this, if you're doing 10 other different things at the same time, if you don't have the right training, you're not going to do a right job. And unfortunately, Mr. Cain did not get the right job. Number two, that gets expressed in a couple different ways. For example, the way he's positioned for his injection in the knee, anatomically, it's just wrong. You know that they're not going to hit the right spot. And what's interesting in the video is that you do actually see Dean Cain crumpling over like he just got hit over the head with kryptonite. Really what happened was it was bad injection technique. Bad training, bad injection technique. That's what happened. In that regard, the injection was done blindly. There are physicians who think that because of their experience, they can inject a joint just based on feel alone. My sense is that unless you have X-ray vision, unless you have Superman, vision, you need to use X-ray and ultrasound guidance to do this properly. In addition, the other kind of big glaring problem with this article is that Mr. Cain also had an injection of umbilical cord fluid. So this is being sold and marketed and branded as stem cells, but the reality is that there are no live cells in this sort of product. Two different groups have looked at this issue thus far, and there are no significant live cells. If you take a product, whether it's umbilical cord fluid or amniotic fluid, you freeze dry it, shock thaw it, ship it hundreds of miles, there's no live cells in that. So what Mr. Cain received, what Superman received, was not a stem cell injection with bad technique by the wrong person. It's important to call this out because the reality is that as patients, as individuals, we need to stand up for what's right and what's wrong in terms of our own health. As physicians, we need to stand up for what's right and what's wrong in our own profession. If you're going to get a treatment for your knee in this regard, a regenerative medicine treatment, whether it's platelets, other kind of blood products, stem cells, make sure you're getting the right thing. Know what's right, know what's bogus, so that you don't get scammed like Superman did. Thank you for your time. Leave me a message. Let me know what you're thinking. And look forward to talking to you later. Bye-bye.